For many years, GIZ has been working on behalf of the German government and other commissioning parties for sustainable development and improved living conditions in partner countries worldwide. The COVID-19 pandemic has demonstrated the importance of long-term cooperation with national and regional partners and has shown what is possible when we work closely together to overcome a crisis. Especially in the area of health and social protection, GIZ, on behalf of the German government, responded quickly to partners' needs. We would like to tell the story of a few of them. Kyrgyzstan has the highest maternal mortality rate in the region of Europe and Central Asia. And even though deaths among children under 5 have significantly declined in the last decade, the number of neonatal deaths has fallen at a much slower rate. The perinatal health program in Kyrgyzstan supports efforts to build expertise and improve the quality of health services with a specific focus on maternal and newborn care. At the beginning of the COVID-19 outbreak, healthcare workers were the ones at the forefront. But they had limited knowledge about the virus and limited capacities in infection prevention and control and personal protective equipment. The virus was spreading rapidly among them, and by May 2020, over 1/4 of all COVID-19 infections in Kyrgyzstan had been registered among people working in healthcare facilities. The GIZ program provided rapid support to primary healthcare facilities and maternity hospitals to improve their infection prevention and control systems. Besides the emergency support to organize the work of the Regional Coordination Unit, more than 200 staff members were trained in healthcare facilities in the target region Osh. An action plan was developed, and the procurement of autoclaves for sterilization of equipment was organized. For continuous training on infection prevention and control, online training modules were developed, and new modules were integrated into the Safe Delivery app, which is used by the midwives. But also, the development of a COVID-19 database by the Ministry of Health was encouraged, so that the tracking of contacts and treatment of patients at the healthcare facilities could be made possible. Thanks to a special mission by the SEG, the German Epidemic Preparedness Team, lab technicians could be trained to conduct PCR tests and sequencing of the COVID-19 genome. A great deal of knowledge was transferred in a very short time, but the impact and the long-term benefits in prevention and preparedness will be even greater. But that was not the only program that proved that knowledge is a key resource in prevention. We can find another example in Liberia. Since the devastating Ebola virus outbreak of 2014 to 2016, the Liberian German Health Program has been working to strengthen systems and capacities for disease surveillance and response at national, county, and community levels, with a specific focus on the most rural counties in the southeast of Liberia. But even after 4 years of intensive preparation, challenges posed by the novel coronavirus were significant. New knowledge on the virus, updated guidelines, access to observation and isolation facilities, and relevant supplies were needed. The program's close and long-standing collaborations at all levels enabled rapid and effective activation and support. Besides the support at health system level, including training of healthcare professionals and rapid response teams, the program supported partners in getting already existing isolation facilities up and running and using them even more extensively. Another key element was raising community awareness. Through community engagement meetings and special radio sessions, the population in the southeast of Liberia and Montserrado was sensitized about COVID-19. The quick activation of the epidemic preparedness and response system demonstrated the progress that has been made over the last few years. Liberia still faces major hurdles, but the ongoing efforts from the government, GIZ, and other partners have shown the prospects of a more systematic approach to disease surveillance and response, improved availability of isolation facilities, and trained healthcare professionals, and have also increased awareness of the importance of functional communication chains, community engagement, and an effective referral system. The presented programs and their measures in the COVID-19 pandemic showcase only some of the enormous global efforts and achievements of GIZ in supporting health and social protection systems in the wake of the pandemic. If you want to find out more about other GIZ projects and what they have achieved during this very intense time, watch episodes 1 and 3